Good morning, bonjour tout le monde. I hope everyone is faring well. 2 days ago on Wednesday, I mentioned what a difficult week it has been for Canada and for Yukon and for Watson Lake. And today I mourn with Watson Lake and with all of you as we announce the death of one of our Watson Lake cases, who now has become Yukon's first COVID-related death. This individual who we lost yesterday was someone who was older and who had significant underlying medical conditions. These we know are the ingredients for worse outcomes in COVID. The individual was being closely followed, was still at home, and thus departed us unexpectedly but peacefully. I want first of all to express my condolences to the individual's partner and family. Of course, the family will need time and space to grieve, and we need to give them as much time and space as they need. This is a very sad day for Yukon, one that I had hoped we would not see, that somehow we could spare everyone from the worst outcomes of this virus. But as I stated just the other day, we are just as susceptible here to COVID as people are anywhere else. May we use this sad and historic day in Yukon to absorb just how serious an infection COVID can be. We all need to redouble our efforts to protect our elders and our more vulnerable citizens by preventing spread of infection, by reinforcing our Safe 6 measures, and observing all the practices that we know need to be in place. I want to just repeat some of this in French. C'est aujourd'hui que je suis avec les citoyennes de Watson Lake et avec vous tous alors que nous annonçons le décès de l'un de nos cas de Watson Lake. On annonce donc le premier décès lié à COVID au Yukon. La personne que nous avons perdue hier était une personne âgée et qui souffrait de problèmes de santé sous-jacents. Nous savons que ceux-ci sont les facteurs qui peuvent causer des pires résultats avec COVID. L'individu était suivi du près, était toujours à la maison et nous a donc quittés de façon inattendue mais pacifique. Je tiens tout d'abord d'exprimer mes condoléances aux conjoints et à la famille de la personne. Bien sûr, la famille aura besoin de temps et d'espace pour chagriner et nous devons leur donner autant de temps et d'espace que nécessaire. In respect of this grave occasion and in deference to the person's family, I want to keep this announcement short. I do want, though, to acknowledge briefly our latest case number 23 that we announced yesterday, who is a known contact related to our cases 16 and 17, and who is already under surveillance in isolation. And that person continues to be doing well in Whitehorse. As far as our outbreak in Watson Lake, we remain at the 5 known cases, with just a few more tests outstanding in some individuals. We have tested many individuals, 53 as of today, with negative results for all of them except for the 5 that we know. And so we're now more confident that we are not seeing ongoing transmission. Halloween weekend is now almost upon us. I still wish for everyone to be out, to be active, and to have a weekend of safe and modest celebration. Please refer to the guidance that we have published on observing a COVID-safe Halloween. And if any parties must occur, please keep them to your household bubble, if indoors, and to a well-spaced and small number if outdoors. For any Yukoner feeling distressed or seeking support at this time, remember that a variety of supports are available. Specifically for Watson Lake, if you need to talk to someone about your mental health, contact the Watson Lake Mental Wellness and Substance Use Services Office. Staff are there to provide daily support through the week, Monday through Friday, between 8:30 and 5 p.m. Specific booking information is now posted online. And you can also call the Mental Wellness and Substance Use Services main phone line, toll-free, at 1-866-456-3838 if you have questions about the mental wellness programs and services. I want to thank all our leaders, to our public health and our healthcare providers, to our essential workers, and to all our citizens for all your help in keeping COVID to a minimum. Adhering to all these measures will help to protect Yukoners who are more susceptible to COVID-related complications and serious illness. We've had our challenges lately, but we are still overall doing well. As we look south to surging activity, we must be vigilant and we must persevere and support each other in our efforts. We must continue to live our lives with all the precautions in place to protect us from COVID spread, but we can still live our lives actively and fully. And that's all for my update today. Thank you.
Thank you. We'll go to the reporters in the room, and we'll start with Chris from CBC.
Thank you. Doctor, I know that you are limited in what you can tell us about this person's case, but quite recently we were hearing that, people were recovering at home. It seemed to be proceeding relatively well. How quickly did this happen, and can you give us some more information about what exactly caused this person's condition to deteriorate so quickly?
Yeah, thank you, Chris. And yes, it's a sensitive question, but it's also an important one. And like I say, this was unexpected. And in fact, the individual was nearing the period of time that we thought that usually is in the period close to recovery. So but we also know that, and I think this is the learning point or the reminder point, we know that in people who are older and who are more susceptible because of underlying medical conditions, status can change very quickly and can turn around on a dime. And this is often seen in the second week of illness, where there are a variety of complications that you will now see as witnessed in healthcare reports. The complications such as inflammatory reactions, complications such as clotting abnormalities. So you can get sudden clots. So, for instance, a clot in the lungs or in the heart, cardiac complications, things like this can come on quickly. I suspect it's in that area of complications that something happened. We will probably not know for sure, but we know that this is in the realm of known complications of COVID illness, particularly in those with underlying conditions.
Yes, but I'm going to ask Dr. Hanley if you can repeat the question. Folks on the phone line can't hear the question.
Sorry about that. So the question from Chris was, could I give any more information about what might have happened, that given that the individuals, all of the people that we were reporting were doing well, how what happened or might have happened for such a sudden change?
And then I guess my follow-up is, again, earlier this week, you heard the message, effectively steady as she goes in terms of public health measures, in terms of the safe six and everything that people should be doing. What does this incident change anything about your public health advice or any orders that you have issued or may issue?
Yeah, so Chris's follow-up question is on whether, given all of the recent updates where I've stressed the importance of public health measures and the Safe Six and adhering to the orders, does this change anything? And I would say no. This unfortunate event does not change, except to me to reinforce the importance of protecting our vulnerable citizens, and whether vulnerable because of settings, living conditions, underlying medical conditions, or age. These are the reasons why we need to be so serious and vigilant about COVID, because we know that most of the time, in most people, COVID presents a mild illness, but we know also that unexpectedly and somewhat randomly, COVID can be fatal or cause serious complications. And we also know that the higher the age, the more the medical conditions, the higher the risk. And really, again, I think the reason that we all need to practice these measures is not only to protect ourselves and to limit the spread of COVID, but ultimately to protect those who are really much more susceptible to COVID infection.
John, CPRW? No questions? Haley, Yukon News?
Yeah, I was wondering if you could give us the timeline for when this took place, if the person passed away last night or early morning today.
Yes, Haley from Yukon News wondering when the individual died, and we learned of this late yesterday afternoon. I actually can't tell you the exact time of death, but it was yesterday afternoon.
Thank you. The question I want to ask again, these are kind of sensitive, and I realize you can't speculate. Is there a chance this person would it better for this person to be admitted to hospital, and will any way you handle these cases change at all going forward?
So Haley's question is about, I think about whether knowing about what happened might have changed anything, or whether this person could have been in hospital or should have been in hospital. Yeah. Yeah. From what we understand, no, there wouldn't have been a difference. I think, again, individuals, we have had other people, and of course Canada's experience is that many people, even older people, do very well at home. And the vast majority of people do well and recover at home, even those who are older and with underlying medical conditions. It's important to note that all of our cases are followed daily, and they're followed by YCDC nurses, daily check-ins to see how they're doing, to make sure that if there are any concerns, that those concerns are relayed. In this case also, there was daily follow-up from the physicians attending. So I think it just shows that sometimes things happen suddenly, and again, this is one of the characteristics of COVID infection. Of course, we will always try to learn as much as we can from one case, and what can we do better for other people. But I think the care that was provided to this person was as it should have been.
We're going to try and go to the phone lines for a few questions. We are getting a lot of feedback, so please, if you're not asking a question, mute your phone. If we are getting feedback, we'll have to not entertain questions from the phone lines, and you folks can all call me after the call, but we'll give it a try and see if it works. So we'll start with Chuck Tobin, Whitehorse Star.
Thank you. Dr. Hanley, I'm just wondering if any of the family members, my condolences, any of the family members or medical staff, nurses, doctors who had contact with the fella, whether they have undergone testing. Is that a necessity, or is it common practice, or is it not necessary in this case? And just quickly too, can you clarify, did the fellow die Wednesday or Thursday?
Yeah, thank you. So, two questions from Chuck at the start, and the one was clarifying the time of death, which was yesterday, Thursday, and secondly about case contact management. So, Yes, so I want to note that the contact management and case investigation was from the time that cases were detected. So at the time of that a test is positive on a case, that is when the contact tracing begins. In terms of the any individuals that were in contact with that individual, and any locations of interest, and that's where we look for any places where the public may have been exposed. So all of that really begins with the diagnosis of the case. So and of course that is what has been occurring over the past few days with the Watson Lake cases. So none of that changes as a result of this individual's demise. The processes that needed to be in place from a public health point of view were already in place.
We'll move now. Sorry,
Thank
go
you.
ahead.
And yeah, I guess that's all I have. Thank you.
Thank you, Chuck. We'll move to Marine, Laurent Boréal.
Merci. Docteur Hanley, comment est-ce que vous vous sentez avec ces talons?
J'ai pas bien compris la question. Est-ce que vous pouvez répéter?
Oui, merci. Est-ce que vous m'entendez?
Oui.
Oui, d'accord. Je me demandais comment vous vous sentez, docteur Hanley, avec cette annonce. Est-ce que vous vivez de l'inquiétude ou est-ce que c'est quelque chose que comme vous aviez annoncé avant, auquel il fallait se préparer? Comment vous sentez-vous avec cette annonce?
OK, merci pour la question. Ben, je sens, pour moi, je sens triste et je sens pour la famille, je suis triste pour la famille et pour la communauté de Watson Lake. C'est quelque chose que, au même temps, on sait que c'est quelque chose qui peut nous arriver, qui peut nous arriver encore, et qui nous rappelle l'importance de faire toutes les mesures préventatives. Pour moi, c'est une journée très triste, mais c'est peut-être une partie de la voyage avec cette pandémie qu'on ne peut pas tout à fait échapper les effets de cette pandémie. I will just repeat the question was about how I feel and how I feel about this case happening and this unfortunate event. And I just wanted to again repeat how sad I feel for the individual, for myself as being in charge of the public health response. Of course, it's a very sad day, and I feel for the community as well as for the family, and for all of us. I think it's something of a shock. So I think we know at the same time, though, that this is part of our journey through the pandemic, and that though we hoped that this would not happen, we also know it may well happen again. And I think all it can do is help us to redouble our efforts to do this together, to work together, and to do our best in prevention.
Avez-vous une autre question, Marine?
Non, merci.
Merci. Terry, Canadian Press.
I understand why you wouldn't want to, reveal any names, but I'm wondering why you don't want to reveal the gender of this person.
Yeah, I'm going to really. This is a very raw moment for the question. Sorry, the question was why I would not reveal the gender of the person. I think that it's important to understand, first of all, how raw a time this is for all of us, but particularly for the family and for the individual and also for the community. And as I have said many times before, confidentiality is at the forefront of our public health approach. And it's the way that we respect each other, and it's the way that we maintain trust in our system. We are not like BC, we are not like Ontario. We are a very small community, a small jurisdiction, and every added detail we give leads to the added ability for individuals to be identified. So it's out of respect for the individual and the family that I maintain this level of confidentiality, and meanwhile disclose as much as I think we need to know and should know for reasons of transparency and for reasons of knowing what the risk is and where we need to go next.
Do you have a follow-up question?
So I understand there's source is there any thought on testing?
I'm sorry, we can't hear you. Could
Is there
everybody
any
please,
thought on asking?
sorry, can everyone please mute their line unless you're asking a question? Can we try
Sorry,
that question one more
yeah,
time?
yeah, I can hear you. Go ahead now.
I see that the population of Watson Lake is about 800 people, and I understand that the source has not been found. Is there any thought on asking, these people to step up and all get tested?
So the question is there any thought about asking everyone to get tested, given that it's a population of 800? Yes, that was a thought, but it's not an action that we need to take, or that would necessarily be a useful action. And again, we've tested a large, actually a significant proportion of the population when you consider over 50 individuals in a town of 800. And we have largely satisfied ourselves about containing this outbreak. We may see one or two, perhaps a few more cases associated with this, but it'll be within that overall aspect of a contained outbreak. I think we can be pretty confident to say now, rather than a kind of an ongoing spread or transmission within the community. So that's good. So finding the source, we have other ways for looking for the source, and that's when we begin to take more of a methodical look back, further questioning, and looking at where exposures likely occurred, and doing a little bit more focused detective work. I actually don't think, even if we were to test the whole community of Watson Lake, I don't think that would actually give us clues as to the source of the outbreak, because what we would be doing is testing people now, which would not necessarily give us an indication of what was the relevant exposure several weeks ago. So I think we do have an approach for going forward. We may, as I said before, we may or may not find the source. I think really the critical thing, though, is containing the spread of infection, and we've been largely successful at that.
Thank you. Laura, CBC?
Thank you.
Laura, CBC?
Oh, hi there. Dr. Hanley, I'm wondering if you can give any indication of how the other cases in Watson Lake are doing, and if there's anyone else who may be at risk of these kinds of complications.
Thank you. Well, to some degree, everyone is at risk of these complications. So I don't want to underplay that there is a risk. But our cases are all doing well to date, and we continue to do the daily check-ins for the other cases. And I think our information is that they continue to do well at home.
Next question, Laura?
Thank you. I'm also wondering if you're reconsidering any of your guidance around wearing masks. Should Yukoners be wearing masks more often when they're in stores, for instance?
I think any time that something rattles us as a community, whether it's the new cluster of cases that we had, or now someone that's died, again, I think it begs us to look at all of the preventative measures. I think that the most critical part about mask wearing is using a mask in places where physical distancing cannot be attained. And part of that is adhering to existing mask requirements per agency or institution or place that is asking for that. And I really ask that Yukoners, when that they respect the policies that are present, whether that's a policy for a workplace, for a retail setting, for transit, for another area, that you do the right thing and adhere to the mask policies where they exist. And if, as I said in my last update, if in doubt, if you're not sure, if it looks crowded, have a mask with you and put it on.
Thank you. We'll move to Jane, CBC.
Hi, Dr. Hanley. So you spoke about this a little already, but it sounds like the source of the outbreak in Watson Lake is still unknown. I'm just wondering if you can confirm that and what work is being done to determine the source.
Yeah, thank you. So yes, we haven't found the source, and as I say, the focus of the investigation has really been on doing the containment, which, as I say, we've been doing well at, and then finding the source is kind of the next step. So I can't give you details at this point in those steps. I'll bring a bit more information with our next media update during the week. But it really goes back to where did the exposures appear to have occurred, where, matching it up with the dates, and then doing a bit of a look back at anyone else, and then really trying to trace back individuals and follow up with individuals that may have been there, and with whatever information we have, to do some further questioning.
Question, Jane?
And yes, I'm just wondering how are the nursing and medical staff in Watson Lake feeling or doing today? Have you talked to them?
Yes, thank you for asking that. The question was about how the medical and healthcare staff are doing. I actually did have a conversation with Watson Lake medical staff and hospital staff and the public health staff today. And we have been in close touch with the medical practitioners since yesterday afternoon as well. So I think they're all feeling a little shaken, a little sad. And, I think to lose a patient is always, it always hits you, in your heart. So I think they're pulling together, and I think Watson Lake is such a great community for being unified and working together. And I think we're supporting them. They're supporting us. We're kind of all working together on this, and we, I think, rely on each other's support to get through this.
Thank you. Claudiane, Radio-Canada.
Oui, je me demandais
demandais en français, si possible, de me dire si vous pensez que le patient aurait pu être sauvé s'il avait été placé à l'hôpital.
Oui, merci pour la question. Claudienne, avant que je continue, je vais juste expliquer en anglais. The question was one I've already answered, but to repeat in French about would this patient have done better, or could this patient perhaps have been saved had the patient been in hospital? Et donc je veux parler peut-être du fait que quelquefois ce qu'on voit dans les cas de COVID, c'est des complications soudaines, tout à coup, qui peut arriver, surtout pendant la deuxième semaine de la maladie. Et même qu'il était suivi tous les jours, la personne était en un état bien stable, aussi jusqu'au point d'être considéré comme récupéré. Cet événement est arrivé tout à coup. Et on sait qu'on a des complications comme ça avec COVID. S'ils sont des coagulopathies ou les problèmes avec la coagulation de sang, qui peut arriver avec une thrombose ou les complications inflammatoires. C'est les complications qu'on pouvait pas, on n'a pas pu empêcher même si la personne était à l'hôpital.
Prochaine question, Claudienne?
Est-ce qu'on... Oui, donc je comprends que non, ça n'aurait rien changé. Tout de même, vous dites dans la deuxième semaine, pour les personnes âgées ou malades, on voit souvent des difficultés. Est-ce qu'on va changer les protocoles de soins suite à ce décès?
Oui, la question c'est si on change les protocoles avec l'expérience de cet individuel. Non, c'est le protocole, c'est de bien suivre les patients, tous les patients, avec ou des visites ou des appels téléphones tous les jours. Et donc, mais on reste très connaissante du fait qu'on peut avoir les complications. Malheureusement, ça change pas. Si on, par exemple, si on a mis toutes les personnes avec un certain âge à l'hôpital, je pense que c'est pas pratique et ça va pas forcément changer les quelques complications de COVID. Donc on a des indications pour qui entre l'hôpital avec des protocoles cliniques qui étaient avec l'expérience de quelques mois maintenant. Et mais peut-être comme aux autres maladies virales ou aux autres maladies, il y a des fois des complications inattendues.
Thank you. And I believe you had already answered that question in English, correct?
Correct.
Yes, okay, thank you. So that's it for our callers today. I'd like to thank everyone for their time and for your patience as we work through the glitches. Our regular COVID update will take place on Wednesday, November 4th at 11 a.m.